All right, we're gonna do a short arm cast here. So Rachel just put on the stockinette. She's about ready to apply the padding. It's really important that when you're putting on any type of cast that you make sure that on the sleeves there's no wrinkling, and make sure that you apply adequate amount of cotton, especially in our older ladies and people with skin breakdown.
Always want to overlap about halfway. And personally, I always like to add a little extra.
I do too.
Around the thumb.
Also too, when you put on your stockinette, see how there's excess kind of covering the fingers and kind of up by the mid forearm that we can fold over later.
I also just like to give a little extra around the MP joints. And we just want to make sure that ulnar styloid is also well padded. Okay.
All right, so you're gonna wet the casting material with glow-in-the-dark white because it's my favorite color.
This is actually glow in the dark.
No, it's not. I wish it was. I have a glow-in-the-dark retainer.
So if you can either fold it or cut it around the thumb. You want to make sure you can bend those fingers.
We always leave the palmar crease free. It's really important.
And you're always going to roll away from you. It's a lot easier, again, overlaying 1/2 of the fiberglass. And I'm just going to use up all the fiberglass here.
I always too, when I put these on patients, I always tell them to spread their fingers to make sure it's not too tight so the hand is extended out.
And so once you get one layer, that's where you're going to place your mold. So you have them rest your elbow on the hard surface. And it's called a 3-point mold. So one palm just below the fracture site, the other palm just above it. And you're going to just put a little pressure, almost in the shape of a banana. And you're going to hold. You're not trying to flex the wrist forward, but you're just trying to prevent dorsal slippage of that fracture. Most commonly, these are being put on for a Colles fracture, which usually the fragment is being pushed dorsally. And you're just going to hold until that dries. The warmer the water you use, the faster the fiberglass will dry. Sometimes it's helpful to have someone else put a hand or use your knee to put behind the patient's elbow if you need a little bit more stability there, or counter force, I should say. And you're always going to use your palms to make a mold, never your fingers. Nice and firm.
Check that out.
Bam. And you're going to fold
over
down your layer. You want to be able to see those NPs.
See the palmar crease.
Fold down your thumb piece.
I'm so excited. I've only broken my arm once in 3rd grade. Damn zip swing.
And you know, Abby's got a nice long forearm. I may extend the cast just a little bit lower, but for teaching purposes. So nice and padded around the thumb. She can move her thumb. Nice and padded here. Nothing sharp.
Not too tight.
And then we use one last layer of fiberglass, and you're just going to follow along the same lines. Leaving some of that cast padding and the black material here that I'm blanking on.
Stockinette.
The stockinette exposed so that you have no sharp edges coming in contact with skin, particularly while it flexes. So again, you fold that in half here.
Now it's up to you what your preference is. I like to kind of fold or roll. Some people will cut. It just kind of depends on who taught you what you prefer to do.
And you're always going to use 2 layers of fiberglass. You want to make sure that when this cast is dry, there are no points where you can bend it or flex it at all.
Correct.
And usually the second layer won't require any molding because your mold has already dried. Some of you like to use soap to dry, that's fine. But you can see when she bends her fingers, no irritation. Thumb, nice and padded there.
Bam. So one little thing, okay, casts aren't meant to be pretty. They look cooler, but they're meant to be functional, and this is a functional cast. As you can see here, I have that mold like she was talking about. My thumb is freely movable, okay? I could bend at my palm or crease. There's no raw edges any place else, so just keep that in mind. Those are the things to look for. Thumbs up.